Every day when patients leave their house, they're interacting with the world. Their face is what they're doing it with. Whether it's an elective surgery or whether it's something they didn't have control over, like a skin cancer, getting them to feel as comfortable and confident in themselves. I get a lot of meaning in my career in helping people that way. Hi, I'm Dr. Senner. I'm a facial plastic and reconstructive surgeon, and I work in the Department of Otolaryngology, head and neck surgery. I absolutely love working here. That was part of one of the things that made it a no-brainer to sign on after I completed my residency training. I had spent time up here previously and gotten to know the staff that works in the clinic, the staff that works in the ORs, and I could not imagine a better group of people to work with. I treat patients with ear, nose, and throat issues, and I also treat patients under the realm of facial plastic and reconstructive surgery. I'm also seeing a lot of patients after their skin cancer resections, which I think is an excellent representation of the field itself because you're trying to balance that form and function aspect for the patient. You want to make sure they can breathe as well as possible. Some patients don't want their nose to change how it looks. Some patients do want a little bit of change. So it's really fun to be able to kind of help meld that together for them.